What is ibuprofen? Ibuprofen is a nonsteroidal anti-inflammatory drug, commonly known as an NSAID. As a nonsteroidal anti-inflammatory drug, ibuprofen provides therapeutic benefits without the side effects associated with steroids. It's primarily used for three main purposes: relieving pain, reducing inflammation, and lowering fever. Ibuprofen is available over the counter in various forms, including tablets, capsules, and liquid suspensions, under brand names like Advil and Motrin. Ibuprofen was first developed in the 1960s, received its patent in 1969, and gained FDA approval in 1974. Since then, it has become one of the most widely used pain relievers worldwide. Today, ibuprofen stands as one of the essential medications for managing pain, inflammation, and fever around the world. When tissue damage occurs, the body initiates an inflammatory response. Damage to tissues triggers a cascade of events designed to protect and repair the affected area. The body releases chemicals that attract immune cells to the damaged area. Blood vessels dilate, increasing blood flow to the area, which causes redness and warmth. Prostaglandins play a key role in this inflammatory response. These chemical messengers amplify inflammation and pain signals. Ibuprofen works by inhibiting the production of prostaglandins, reducing their inflammatory effects. By reducing prostaglandin levels, ibuprofen decreases inflammation symptoms like redness, swelling, and warmth. This anti-inflammatory action makes ibuprofen particularly effective for treating conditions like arthritis, sprains, and other inflammatory disorders. Ibuprofen relieves pain through two main pathways. The first pathway involves reducing inflammation at the source of pain. The second pathway decreases the sensitivity of pain receptors. In many conditions, inflammation is the primary source of pain. By inhibiting COX enzymes, ibuprofen reduces prostaglandin production, which decreases inflammation and subsequently reduces pain. Prostaglandins also sensitize pain receptors, making them more responsive to pain stimuli. When prostaglandin levels are high, pain receptors become more sensitive, lowering the threshold for pain signals. By reducing prostaglandin levels, ibuprofen effectively raises the threshold for pain signals. This means stronger stimuli are required to trigger pain sensation. The result is decreased pain signal transmission to the brain. With fewer and weaker signals reaching the brain, pain perception is significantly reduced. Fever reduction is another important effect of ibuprofen. During infection, the body often raises its temperature as a defense mechanism. This is known as fever. The hypothalamus in the brain acts as the body's thermostat, regulating temperature. Prostaglandins affect this thermostat by raising the body's temperature set point. Ibuprofen works by blocking prostaglandin production in the hypothalamus. This allows the body temperature to return to normal, thus reducing fever. Let's examine how ibuprofen is absorbed and distributed throughout the body. When taken orally, ibuprofen enters the gastrointestinal tract. The drug is rapidly absorbed from the stomach and small intestine into the bloodstream. Ibuprofen typically reaches peak blood concentrations within 1 to 2 hours after ingestion. Once in the bloodstream, approximately 99% of ibuprofen molecules bind to plasma proteins. Despite high protein binding, ibuprofen is effectively distributed throughout the body's tissues. Importantly, ibuprofen can cross the blood-brain barrier, allowing it to affect the central nervous system for pain relief and fever reduction. The presence of food in the stomach can slow the absorption of ibuprofen. However, while food may delay absorption, it doesn't significantly reduce the total amount of ibuprofen that enters the bloodstream. In summary, ibuprofen is rapidly absorbed from the gastrointestinal tract, highly bound to plasma proteins, and effectively distributed throughout the body, including crossing the blood-brain barrier. Ibuprofen undergoes metabolism primarily in the liver through two main processes. The first process is oxidation, where enzymes in the liver modify the ibuprofen molecule by adding oxygen atoms. This is followed by conjugation, where the modified ibuprofen is combined with other molecules to make it more water-soluble for elimination. Ibuprofen has a relatively short half-life of about 2 to 4 hours. This means half of the active drug is eliminated from the body within this time frame. Once metabolized, the metabolites are primarily excreted through the kidneys and urine, with a small amount eliminated in bile. This short half-life explains why ibuprofen typically needs to be taken every 4 to 6 hours for continuous relief. Ibuprofen differs from other pain relievers in several important ways. Let's compare ibuprofen with three other common pain relievers: acetaminophen, aspirin, and opioids. These medications differ in their mechanisms, effectiveness, duration, and side effects. Unlike acetaminophen, which works primarily in the central nervous system, ibuprofen has strong anti-inflammatory effects. Compared to aspirin, another NSAID, ibuprofen has a shorter duration of action but may cause less gastrointestinal irritation. Unlike opioid pain relievers, ibuprofen is non-addictive and doesn't produce sedation or respiratory depression. While opioids provide stronger pain relief, they come with significant risks that ibuprofen doesn't have. In summary, ibuprofen offers a balanced profile that makes it suitable for a wide range of pain and inflammatory conditions. Understanding these differences helps in selecting the most appropriate medication for specific conditions and individual needs. Ibuprofen's side effects are directly related to its mechanism of action. Let's examine the three major systems affected. In the gastrointestinal tract, ibuprofen inhibits COX-1 enzymes. These enzymes help maintain the protective mucus lining of the stomach. When ibuprofen inhibits COX-1, this protective barrier is compromised, which can lead to ulcers and gastrointestinal bleeding. In the kidneys, prostaglandins play a crucial role in regulating blood flow. When ibuprofen inhibits prostaglandin production, it can reduce blood flow to the kidneys, leading to decreased kidney function and fluid retention. In the cardiovascular system, there is a delicate balance between different types of prostaglandins. With long-term ibuprofen use, this balance can be disrupted, potentially leading to an increased risk of heart attacks and strokes. To summarize, ibuprofen's side effects are directly linked to how it works in our body. In the gastrointestinal system, it reduces stomach protection, leading to ulcers and bleeding. In the kidneys, it decreases blood flow, causing reduced function and fluid retention. And in the cardiovascular system, long-term use can disrupt prostaglandin balance, potentially increasing the risk of heart attacks and strokes. To minimize these risks, it's important to always follow the recommended dosage and duration of use. Section 10. Optimal usage and effectiveness of ibuprofen. Ibuprofen works best when taken at the first sign of pain or inflammation, rather than after symptoms become severe. The effectiveness of ibuprofen varies depending on the condition being treated. It shows excellent results for inflammatory pain and headaches, but is less effective for neuropathic pain such as nerve damage or diabetic neuropathy. The standard adult dose of ibuprofen ranges from 200 to 400 milligrams every 4 to 6 hours. It's important to space doses properly, allowing at least 4 hours between doses. For over-the-counter use, do not exceed 1,200 milligrams daily unless directed by a healthcare provider. Taking ibuprofen with food or milk can help minimize gastrointestinal side effects. This protective approach helps maintain the drug's therapeutic benefits while reducing the risk of stomach irritation and ulcers. Understanding the optimal usage of ibuprofen ensures you get the most benefit with the least risk.